take your seat as the opening ceremony will commence shortly. And please switch your phone to silent mode. Thank you. You take Excellencies, distinguished guests, participants, ladies and gentlemen. Keynote speech by Minister for Foreign Affairs of the Republic of Indonesia, who in this occasion is represented by Dr. YAYAN MULYANA, Head of Foreign Policy Strategy Agency, Ministry of Foreign Affairs of the Republic of Indonesia. Please welcome Dr. YAYAN MULYANA.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, good morning. Salam sejahtera bagi kita semuanya. Shalom, Om Swastiastu, Namo Buddhaya, salam kebajikan. His Excellency Professor Dr. Muhajir Effendi, Coordinating Minister for Human Development and Cultures of the Republic of Indonesia, Honorable Dr. Laksana Trihandoko, Head of the National Research and Innovation Agency, Professor Sin Huang Michael Xiao, Chairman of the Seasea Consortiums, Professor Bart Brander of Leiden Institute of Culture, Anthropology and Sociology, distinguished speakers and participants, ladies and gentlemen, Bapak-Bapak and Ibu-Ibu. I wish to begin my remarks by congratulating the National Research and Innovation Agencies on the convening of this 4th Seasea Biennial Conference in collaboration with the Research Organization of Social Sciences and Humanities and members of consortiums of Southeast Asian studies in Asia. The theme that this conference takes, managing disruption, developing resilience for better Southeast Asia, is highly pertinent. I am honored today to represent His Excellency Retno Marsudi, Minister for Foreign Affairs, to address this important conference to shed some lights on Indonesia and vaccine COVID-19 diplomacy. Excellencies, ladies and gentlemen, the Chinese proverb says, "May you live in interesting times." We are indeed living in an interesting time, a time where humankind is in such intensity, confronted by multiple complexities and multiple challenges. These challenges are generally unprecedented, unanticipated, and unknown. No one and no country was prepared to face these unknowns. And of course, one of these unanticipated is COVID-19 pandemic. The pandemic that carries with it disruptions that deeply penetrate and shake many foundations of our life. The pandemic that caused crises like no other. And no country has had experiences in tackling an existential challenge with a magnitude like that of COVID-19 pandemic. Yet all the governments had to respond in a decisive and bold manner, make tough choices which were not always easy and not always popular to the public. They had to refocus their national budgets, reprioritize their development goals, and concentrate all the resources they had to expeditiously and effectively address the pandemic. These, of course, include our diplomatic resources. In the case of Indonesia, since the first incidence of COVID-19 was officially declared in March 2020, the country swiftly adapted its foreign policy and diplomatic priorities, refocusing on the attainments of medicines and medical devices. These medical devices include masks, surgical masks, gloves, and other personal protective equipments, as well as respirators, ventilators, and oxygen supply. And after a few months, through a series of diplomatic efforts, Indonesia managed to secure the sufficient availability of those medical devices and even helped open the opportunity for the flourishing of health industries in medical devices in the country. The industry turned out to be robust amidst surge in cases of COVID-19, making the country one of the most prepared in delivering well-targeted responses. Key to this success is collaborations and partnerships with other countries. The power of collaborations and partnership through bilateral as well as multilateral mechanisms has also been instrumental in what we coin today as vaccine diplomacy, a new notion in the glossaries of the practice and studies of diplomacy and international relations. As an illustration, as of April 2022, Indonesia succeeded in securing a total of 510,350,022 doses of vaccines. And of these number, 130,662,975 doses were obtained either through multilateral scheme, the COVAX facility, or the bilateral dose sharing scheme. And by having this, Indonesia currently occupies the 5th positions in the list of countries with highest doses of vaccine injected, with a total more than 401 million vaccine doses, both primary and booster vaccines. Accordingly, Indonesia is able to meet the WHO target to provide full vaccinations to 40% of the populations by the end of 2021 last year. And currently, 80.55% of Indonesia's total population has received second dose of vaccines. Indonesia's vaccine diplomacy strategy gives emphasis on the need and interests of other nations. It attaches particular significance to ensuring access equality to vaccines for all countries. While vaccines rollouts in developed countries are relatively high, many low or middle income countries are still struggling in reaching the vaccination targets. They also have limited capability in providing diagnostics, therapeutics, and protections for their people and their health workers. The inequalities not only risk prolonging the pandemic, but also cause many other impacts, slowing the economic recovery of entire countries, global labor markets, public debt payments, and countries' ability to invest in other priority sectors. UN Secretary General Antonio Guterres called vaccine inequality the biggest moral failure of our time, allowing COVID-19 variants to develop and run wild, condemning the world to more deaths and prolonging an economic slowdown. In its position as one of the co-chairs of COVAX AMS engagement group, Indonesia is working to promote vaccines equality. At the end of 2021, The COVAX facility has succeeded in distributing 811 million doses of vaccines to 144 countries and entities. Indonesia has also been working to assist countries that are still having difficulty in making vaccinations targets, including in Africa. In 2022, for example, Indonesia facilitated a grant of 127,000 doses of pentavalent vaccines and 1,000 doses of COVID-19 vaccine produced by state-owned company PT Bio Farma to the governments of Nigeria. Indonesia is also a strong supporter for WTO TRIPS waiver proposal with a view to safeguarding the equitable provision of vaccines, not only limited to COVID-19 vaccines, but also those for possible future pandemics. Another strong emphasis that Indonesia's vaccine diplomacy strategy places on is the strengthening of the national and global health architecture. 2 steps have been taken in this regard by Indonesia. First, Indonesia is striving to develop national health capacity through international cooperations and partnerships, including developing capacity in producing vaccines. And in this regard, Indonesia has been appointed as one of the recipient countries of WHO technology transfers for mRNA platform vaccines technology. Second, we are encouraging research and development in the health sector. For instance, we advocate the vaccine development ecosystem to benefit from international research collaboration networks such as the Coalitions for Epidemic Preparedness Innovations, or CEPI. I must also add, Excellencies, ladies and gentlemen, that Indonesia has included building a global health architecture as one of the priorities in its presidencies of the G20. In Indonesia's views, a global health architecture is essential in ensuring the global community's resilience towards any future pandemic. And 3 measures are crucial in realizing this priority. First, the urgent need to prepare a global health resource raising mechanism. Second, the need to prepare global health protocol standards associated with cross-border activities, including health protocols for inter-country traveling. And third, G20 should become a significant part of the solutions to coping with scarcities and disparity of vaccines, medicine, and essential health devices. Excellency, Mr. Ministers, ladies and gentlemen, we have learned so many lessons from our successes and failures in tackling COVID-19 pandemic. The lessons that would certainly help the nations in Southeast Asia and the rest of the globe to emerge from the pandemic. And as the pandemic is not yet over, and be well prepared to face the future challenges. The lessons that tell us that diplomacy can be a very powerful tool for all nations to be well equipped in handling the pandemic through galvanizing solidarity, common responsibility, collaborations, and partnership. I welcome the inclusion of a sizable number of sessions in this conference dedicated to discussions on many aspects of COVID-19, which include COVID-19 policy responses and challenges in Southeast Asia, understanding the social disruptions and impacts of COVID-19 in Southeast Asia, changes, lessons, and strategies, and changing the resilient paradigm in Southeast Asia post-COVID-19 world. I hope and I recognize as well that in 1 or 2 relevant sessions, speakers and participants would also touch upon the diplomatic dimensions of tackling COVID-19, drawing rich lessons from the experiences of Southeast Asian countries. Excellencies, finally, I wish everyone, all of you, all an inspiring conference and fruitful discussions during the course of the conference. Stay healthy, stay strong, stay united. I thank you very much. Terima kasih.
Thank you, Dr. YAYAN YH MULYANA.